Hello, conference participants. My name is CARDIOMETABOLIC. I'm glad to be with you. I'll be delivering a paper titled Dose Response Effect of Exercise Intensity on the Management of Blood Pressure of the Elderly with Cardiometabolic Risk. Cardiometabolic risks are important determinants of cardiovascular diseases, and these risk factors: high blood pressure, high blood glucose, central obesity, dyslipidemia can cluster around an individual. And if these risk factors are not properly managed, they can lead to stroke, heart attack, and other health complications. The current challenge globally is that, in spite of all the investment to reduce cardiovascular diseases, the risk factors, going by prevalence studies, are still on increase. I want to cite a few examples. Presently, WHO said that an estimated 1.28 billion adults globally have hypertension. And in Africa, a study by Bosu et al. Reported that poor prevalence of hypertension in Africa is 57.28%. In Ibadan, in Nigeria, there are other prevalence statistics that have been documented in literature, and the figures are equally high. Now, this has health implications. According to WHO 2016, cardiovascular diseases represent the leading cause of death globally. And in terms of morbidity, we have increase in risk of admission just because of cardiovascular diseases. One study by George et al. Stated that an estimated $500 to $1,500 was spent per episode on cardiovascular diseases. Now, management can take different approaches. One of the management approaches has been through medication, but it can also be through diet or counseling, or in some cases, maybe surgery. And aerobic exercises is effective in attenuating cardiometabolic risk. It can take the form of continuous aerobic exercises or interval aerobic. Now, continuous aerobic exercise refers to rhythmic and sustained activity using large group of muscles, or interval aerobic exercises, which refers to short bouts of exercises interspersed with rest or relief. Now, interval aerobic exercises is an emerging exercise approach, and some researchers have demonstrated the superiority of interval aerobic exercises over continuous aerobics in terms of greater increase in stroke volume, greater increase in left ventricular mass, greater increase in cardiac contractility, greater increase in mitochondrial density, and greater increase in fitness level. Now, aerobic exercises is a non-pharmacological therapy, but the point in research now has to do with effective exercise prescription. There's ongoing debates to unravel the specific dose that can have maximum impact on health. As at present, not much has been done on dose response studies, and there's paucity of randomized control trials. Few studies that have been carried out have methodological issues, especially the failure to specify which aspect of FIT principle was used in the design of the study. FIT is an acronym that refers to the frequency of the exercise, the intensity of the exercise, the time, which is the duration of the exercise, and the type of the exercise. A study was carried out in Ibadan, and the main objective of this study, carried out by the researcher and other two authors, the main objective of the study was to determine the effect of two levels of intensities of exercise on blood pressure. And the study hypothesized that there will be no significant main effect of exercise intensities on blood pressure. The study design was a randomized controlled trial. Ethical approval was given by University of Ibadan, University College Hospital, Ethics Committee, and informed consent was obtained from the participants. The inclusion criteria goes thus: for you to participate in the study, you must have been an adult, male or female participant, ages 60 years and above. The participant must have been hypertensive. Cut-off point was 140/90 of mercury or on treatment for hypertension. Some other cardiometabolic risk factors were also assessed, like the hemoglobin glucose, the waist to hip ratio, waist to height ratio, and the like. Participants did not have any contraindication to participating in the exercise program. They had good cognition and they passed stress test. This table showed the design of the program using FIT principle. The first column here refers to the low intensity and the moderate intensity column. This is the time duration column. For each intensity group, we had 30 minutes group, 60 minutes group. This is the frequency of the exercise, 3 times per week. And this is the type of the exercise, interval aerobic training, which was administered through stationary cycling. And those was estimated using percentage of heart rate reserve. This chart is the treatment stroke recruitment protocol chart, showing the consent obtained from the participant, the general screening, and baseline measurements. Now, after these, participants were taken through stress tests. Those that passed stress tests were randomized into 3 study groups, and those that failed the stress test were excluded from the program with explanation. The randomization was into 3 study groups. The first study group was the routine care group. These participants were actually coming to clinics, hypertension clinic, diabetes clinic, and other clinics. They were assessing treatment from their physicians, physiotherapists, and all that. The only difference was that compared to the experimental group, they did not have interval training program. The other 2 groups were the experimental groups. And we have the first experimental group, which we call the low intensity group. And the other group was the moderate intensity group. The exercise duration lasted 12 weeks, and 3 post-intervention measurements were taken. The first post-intervention measurement was taken at week 4. The second post-intervention measurement was taken at week 8. The last one, at the end of the study, was taken at week 12. Now, as I've said earlier, those was estimated using percentage of heart rate reserve, which was a measure of internal dose. The low-intensity interval aerobic exercise program was administered at an intensity that was either less or equal to 40% of heart rate reserve, while the moderate intensity group interval training aerobic exercise program was pegged at greater than 40 beats, not more than 70% heart rate reserve. And this is according to American College of Sport Medicine guideline. And as I've said, the control group was just the routine care group. This prescription table is similar to the 60 minutes group except for the duration. This is a 30 minutes prescription table. The first column there refers to the days of the week and the number of weeks the exercise was carried out. This is the warm-up column. specifying the different types of exercises. The other three columns at the middle, the first column there was talking about training time, and then the next column was talking about work relief ratio, and the last one was talking about the number of repetitions the exercise was carried out. Now this is the cool down phase exercises, and then the total time was shown there. Now because it was a randomized control trial, strict control was exercised during the intervention program. Number one, the exercise was individualized, and no participant was allowed to go beyond the exercise target zone or below the exercise target zone. Now, before an individual can participate in the study, after the fitness tests have been carried out and he or she was found suitable for the program, and after the randomization has been carried out, there was a predetermined dose that was attached to the patient. And the individual cannot go below or beyond that dose. So metronome was used to control the tempo of the cycling. This was a mechanical device that is adjustable. Now it will provide the rhythm of the cycling, and periodically pulse oximeter was used, a finger probe pulse oximeter was used to determine the intensity. I mean, the pulse oximeter will show you at what heart rate per minute was this individual exercising. At the end of the 12-week intervention period, results shows the following. After 4 weeks, there was no significant reduction in either systolic blood pressure, diastolic blood pressure, or mean arterial pressure. But by the end of the 8-week intervention period, systolic blood pressure showed significant reduction, but not diastolic blood pressure and mean arterial pressure. But at the end of the 12-week, when the study ended, there was significant reduction in all the three parameters measured: the systolic blood pressure, diastolic blood pressure, and mean arterial pressure. Now, these are the dose response curves. The one up there belongs to the systolic blood pressure. The one on the right side up there belongs to the diastolic blood pressure. The one below is the mean arterial pressure. The blue line represents the low intensity group. The red line represents the moderate intensity group. And the ash color represents the control group. From the results, systolic blood pressure reduced from 138.49 to 120.60 millimeter of mercury, while diastolic blood pressure reduced from 78.28 to 72.25 millimeter of mercury. And mean arterial pressure reduced from 98.34 to 88.52 millimeter of mercury. The moderate intensity group had their blood pressure reduced from, the systolic blood pressure reduced from 140.34 to 127.78 millimeter of mercury, while the diastolic blood pressure reduced from 83.93 to 79.87 millimeter of mercury, while the mean arterial pressure reduced from 102.73 to 96.31 millimeter of mercury. In conclusion, there was a dose-response effect of interval aerobic exercise intensity on blood pressure, and that regular low or moderate intensity under close supervision significantly reduced both systolic blood pressure, diastolic blood pressure, and mean arterial pressure. However, the study showed that it's only the systolic blood pressure that has significant reduction to the training program by week 8, but by the end of week 12, all the three parameters showed significant reduction. And this is in line with other researchers, which also concluded that exercise effect cumulates over time. So, meaning that the length of time the exercise was carried out is an important determinant effect. So, the researchers are thereby making the following recommendations: that low or moderate interval aerobic exercises can be employed by exercise therapists in the management of blood pressure, and that elderly people can also avail themselves of these low or moderate interval aerobic exercises to manage their blood pressure. As I've said before, interval aerobics was an emerging exercise concept, and researchers are still making efforts as at present to find out how effective it is. But past efforts have been on high-intensity interval aerobics. So, but other researchers are trying to explore the possibility of low-volume interval training, which some call clinical models. So from this research, whether the intensity is low as 40% heart rate reserve, or moderate, just between greater than 40% heart rate reserve to up to 70% heart rate reserve, can also show beneficial impact on blood pressure. So where for clinical reasons or because of age, an individual cannot carry out high-intensity exercises, they can as well avail themselves of this opportunity to use either low-intensity interval aerobics or moderate-intensity interval aerobics. I'm glad to be with you. Thank you for listening.